5, 4, 3, 2, 1. Let's go. Diary of a Kidney Warrior podcast in partnership with Kidney Care UK, sharing faith, knowledge, hope, and love.
Hi, and welcome to Diary of a Kidney Warrior podcast. My name is Dee Moore, and I am a kidney warrior. This podcast is dedicated to encourage, educate, and inspire as we explore all aspects of kidney disease, related chronic illnesses, and health. If you have any questions or ideas for topics you would like me to cover, please get in contact with me on social media using the handle Diary of a Kidney Warrior. Today's episode is the first in a series focused on pregnancy and CKD. My guest today from Bristol, England, is consultant paediatric nephrologist Dr. Jan Dudley, who joins me to share about the uncertainties experienced by parents during pregnancy, early childhood, and beyond for babies with CKD. Hi, and welcome to Diary of a Kidney Warrior podcast. How are you doing today, Dr. Jan?
I'm very well, thank you, Dee.
Good. Welcome to the podcast. I must say I'm really excited about today's interview because, as everyone knows, I love to cover subjects that don't necessarily get much attention, but really do need to be spoken about. Now, we're going to be looking at pregnancy and early childhood for children with CKD and the uncertainty that parents experience during this time. And yeah, I really am excited about today's podcast. So I'm going to start with my first question. And my first question is, in terms of pregnancy, when is CKD detected or picked up?
Thanks, Dee. So that's a fascinating first question because it's not actually possible to pick up chronic kidney disease in the pregnancy. And this is one of our first areas of uncertainty, I suppose. So during the run of a usual pregnancy, there will be a scan at 20 weeks of gestation. And that's the point where many of these abnormalities are actually picked up. And in some of those cases, but not all, and in fact, relatively few, you can have a fairly good idea, even at that very early stage, that chronic kidney disease or CKD is going to ensue. So, for example, we are normally born with two kidneys, but relatively large. About 1 in 1,000 of us are only born with a single kidney. And just that structural change in itself actually brings on a diagnosis of chronic kidney disease. But that would be chronic kidney disease stage 1. And we would, even at that stage, we would hope that the kidney function will be normal and that the child or young person won't progress through the later stages of chronic kidney disease, at least not until a much later age, usually the 6th or 7th decade. On top of that, if there were evidence of damage to both kidneys, then that would make us concerned, even at that kind of very early time in gestation, that there may be more significant chronic kidney disease. And then you've got the other end of the spectrum, which is when you either don't see either kidney, and that's called renal agenesis or bilateral renal agenesis if it happens on both sides. And very few of those babies will survive pregnancy or the very early days or weeks of life. I mean, a very tiny number. So that very first question is opening up this whole area of uncertainty, because in between, we've got all sorts of different findings where we have to say to the families, we're going to need to monitor this both in pregnancy and after the delivery of the baby, but we can't give you a really good idea of what's going to happen either in pregnancy or after delivery. And every future ultrasound scan during pregnancy and then the tests that we do after delivery are going to help to put that picture together. And I always describe it as being a jigsaw. It's a bit like making the diagnosis, which isn't immediately obvious. And every piece of information that we have helps us to form that jigsaw and a view of what we're looking at and what we're likely to be seeing. over the weeks, months, and years to come. It was a very long answer, wasn't it?
No, that's absolutely fine. So today we're talking specifically about women who don't have CKD themselves but are pregnant and find out at the 20-week stage that there may be an issue with the baby that they're carrying's kidneys. So this is the uncertainty that we're specifically looking at. And speaking personally, when I was told in 2019, we think that you're 6 months away from dialysis, I was able to delay that for 4 years. But during that 4 years, I had the uncertainty of what's going to happen, really trying my best to increase my kidney function, stop myself from going into kidney failure. And that feeling of uncertainty, the only way I can describe it is like an anvil hanging over your head because you just don't know when or if it's going to happen. So in terms of the parents and the process that they go through, what support is given to them during that time to help with that uncertainty?
And again, that's a really important question. And the short answer is it's not something that we perhaps discuss as often as we can and should, because we're often very focused on the diagnosis and the investigations. And I would say that the experience that you've just described there, where you have an anvil hanging over your head because you've got that uncertainty, even though in your case you thought you were going to be dealing with months, and in fact, in the end, it was 4 years. Can you imagine how that's amplified for these pregnant ladies or parents of babies who were born, where we say, well, we don't know. We can tell you what the kidney function is now, or we can tell you what the kidneys look like on the antenatal scan, but we can't predict for you what they're going to do because it's dependent on so many factors. And so, yes, we're very fortunate in some respects that we work with multidisciplinary teams. So we work with doctors and nurses and psychologists and play specialists and social workers, and we all really focus on having a team around the child and family. And we are able to work with the families to a degree to support their concerns and to help them to deal with their concerns. We interface with the schools who are also able to provide that support. But that is really limited in terms of managing that uncertainty, because unlike prescribing treatments, you can't prescribe something that will just remove that uncertainty and the stress that brings with it.
What are the implications of the baby having damaged kidneys during pregnancy?
So the important word there is kidneys. We, as I've mentioned earlier, we generally almost always have 2 kidneys. And as long as one of those is working well, then the implications are really relating to the issues with a single damaged kidney. So one damaged kidney can be associated with high blood pressure, and it's a marginally increased risk compared with age and sex-related peers, but it is something that we'd recommend monitoring for and monitoring throughout life for that. But as a general rule, if you're comfortable that the other kidney, the normal kidney, really is normal, then the implications are really quite limited. And in fact, as I've already mentioned, a relatively high number of people are born with one kidney, and many people don't know about that. So before the advent of antenatal scanning, which came out in the 80s and 90s, people were just not aware of that, and they've gone on to live entirely normal lives. The problems start when both kidneys are affected. And if you've, as you know, Dee, if you've got a condition that affects both kidneys, then there is a risk of progressing through later stages of chronic kidney disease. And stage 5, chronic kidney disease, is associated with very poor kidney function. And that is an indication for kidney replacement therapy. So that's the dialysis and the transplantation that you've talked about. And if you can imagine that anvil that you've described as hanging over your head, as I've mentioned, when you've got a child who's just born, for example, or during the pregnancy, that knowledge that at some point in that young person's childhood, you may need to move to kidney replacement therapy, it's a huge burden for families to have to bear. And and to swing this round to the discussion, which is about uncertainty, we can never quite manage that uncertainty because we don't have the knowledge or the evidence of what's going to happen until it actually happens. We can use various predictive tools. And in fact, there's a predictive tool in adults, but that's not validated for children as yet. We can provide some education. We know that there are points in the child's development where growth can trigger a deterioration in kidney function. The pubertal growth spurt classically can cause a really significant deterioration of kidney function. And we would always counsel families that that is a point where you can convert to that place where you need to have kidney replacement therapy. But we can't give figures, we can't give any kind of definites. And so if both kidneys are affected, the life of that child can be significantly impacted by the monitoring that we have in place. I'm going to take that one step further. If you know you've got significant chronic kidney disease, so if you know you've got stage 3 or 4 chronic kidney disease in childhood, that can affect more than just the need for having kidney replacement therapy. So that can affect the way that the child grows, the way that child develops, the way the child learns, the support the child would need in school. And then you go to the kind of the physical attributes. As you will know, most people realize that their kidneys help the body get rid of waste products and unwanted fluids, the fluid that's not necessary for the body anymore. But many people don't know that the kidneys are also critical for bone health and for keeping up our red blood cells so we don't become anemic. And then, as I've already mentioned, the impact of really poorly functioning kidneys on all of the other body systems can be quite significant, affecting the growth, the way they eat, having nausea, vomiting, and so on. So a lot of these things can be affecting that child and the family, either now or at some point in the future. So it's a really big undertaking to look after a child with significant chronic kidney disease.
So are babies, when they're born, put straight onto dialysis if they're in complete kidney failure?
So this is a really changing landscape. And the short answer is yes, it's possible. And the longer answer is it's much riskier in a newborn baby than it is in an older baby or a child or an adult. And that's because newborn babies don't have a lot of what we call subcutaneous fat. So if you try to put a peritoneal dialysis catheter into the abdomen, as you might know, generally that relies on the abdominal tissue to anchor the tube. In newborn babies, that's very likely to leak. And then when you have leakage, that can be associated with infections. You can have fluid leaks. You can have fluid and salt or electrolyte disturbances as a result of that. So yes, you can do it, but it's much more challenging than it is at an older age. If the baby is premature or small for dates as well, that makes it even more challenging, as you can imagine. The new kid on the block, if you like, is that we can now do haemodialysis in babies upwards of 800 grams, which, you know, in my lifetime already is quite staggering. So in the UK, mostly that's as part of a clinical trial, or it can be done on a compassionate basis. And we've certainly used that very, very successfully in a small number of very small babies who've needed that dialysis. So the answer to your question, Dee, is yes, you can dialyse from birth, but if there's any way of avoiding it safely, then we would until the risks are much lower.
So from what you're saying, unfortunately, dialysis isn't possible for every newborn.
There's a little bit of a difference here between technically possible and being the right thing to do. And so 800 grams is already very, very tiny. So I would say that where we are at the moment, trying to do dialysis on a baby that's smaller than 800 grams would be very, very unlikely to succeed. And the conversation that you might have with parents in that situation is that that is not likely to be in the baby's best interests. So the equipment that we have to deal with babies that are smaller than 800 grams, which would really be very, very premature, is just not there at the present time. It's already a real advance to be able to do dialysis for babies weighing 800 grams. When I started doing this about 30 years ago, you wouldn't have embarked on dialysis in a baby smaller than about 2.5 kilograms. And you'll see worldwide that there are different practices and thresholds for starting dialysis in a very small baby. Fortunately, that's almost at the most severe end of the spectrum. That's assuming that the baby survives the pregnancy. Unfortunately, it's not something that we have to deal with that often, because a lot of these babies have just a little bit of kidney tissue, and we can manage them what we call conservatively until they're big enough to be able to more safely put in a PD or haemodialysis catheter.
So coming back to dealing with uncertainty, what can we do about it?
So, Dee, I think the first thing that we have to do is recognise it. And you've set out really nicely the period when you were waiting to go on dialysis was like an anvil hanging over your head. And that was with a diagnosis, with a level of knowledge about your kidney function as it was at the time, as a grown adult, and with an idea of the time frame to dialysis. And you exceeded that time frame by some margin, but it was still a 4-year time frame. Now, just imagine that situation when you've got a baby or a small child, and you've got 18 years of growth and development of that child, and you don't know when that time is going to be. And uncertainty, I think, is, most of us would recognise in our day-to-day lives, is one of the most stressful things that we can go through. So I think recognition that this is enormously stressful for parents of young children is the first step. As I've said, it's not something that's given a lot of airtime in the clinic room. We have a limited degree of support in the context of the multidisciplinary team, but this is where, to me, peer support groups and the works of the charities can be really helpful. But as I say, that there is no treatment for the stress that arises for uncertainty, is there? And we're all set on management of what we can manage, of the physical and of the identified psychological distress. But the uncertainty often doesn't manifest itself as that. So I think recognition is really important. And then I think more in terms of, well, what we're doing right now, but also peer support groups that you, I think, have got quite a lot more experience of than me even.
Yes, from my experience, peer support has been amazing. I've learnt so much from my peers in the kidney community. And obviously from doing interviews with the podcast, I've learnt so much from Kidney Warrior Stories. Listening to people's experience has been invaluable for me because, as the expression says, who feels it knows it.
If I just come back to say that I'm not sure I've mentioned, but we've done quite a lot of work in patient information for adults, children and young people. And for the children and young people, that's a resource called InfoKid. And we evaluated this resource back in 2017 and went out to 100 or so families and asked what they thought of it, because information is another thing that you can't cover all aspects of in the clinic room. So this is a resource that we're building on. It's now including, it's kind of an interactive site. We're now starting to add videos into that. And the big ask, which is what we're working on, is to start setting up fora for patients, parents and carers who can relate to each other via these sources. So I guess from our perspective, getting together and generating these platforms is a small thing that we could do to at least start to identify this as a real issue.
It's really great to know that there's a resource there that can bring families together who are going through similar situations, and they can get that peer support for each other because, like I said before, who feels it knows it. So it's really good that that resource is out there. And what is the address for the website?
So the best thing to do is Google InfoKid. So that's INFOKID. And it's been out there for long enough now and used often enough. It's the first thing that comes up when you type that into the Google search bar.
And the name of the website again, it's InfoKid. And as always, I will put the link to the website in the description box. So do check it out. Thank you so much for joining me and for sharing about a subject that, as we said earlier, hasn't really had that much attention, but is so important for families that are experiencing this. Hopefully this opens up more conversations and gives people the opportunity to get more support and information. So yes, do check out the InfoKid website, and thank you so much for joining me.
Thanks very much for inviting me.
Thank you for listening to Diary of a Kidney Warrior podcast. And don't forget that you can contact me on social media using the handle Diary of a Kidney Warrior. Please do subscribe to the podcast, and please do tell a friend. New episodes of this podcast are released every other Monday. Until next time, take care and choose to live.
Diary of a Kidney Warrior, sharing faith, knowledge, hope, and love.